So there's a lot of rumors that police are going to be dispatched if you call 988. That's the exact reality we're trying to avoid.
Right.
When you call 988, it is 100% confidential. You do not have to share any personal information. They don't have your location information. They cannot dispatch services.
Welcome to Hope Starts With Us, a podcast by NAMI, the National Alliance on Mental Illness. I'm your host, Daniel H. Gillison Jr., NAMI CEO. We started this podcast because we believe that hope starts with us. Hope starts with us talking about mental health. Hope starts with us making information accessible. Hope starts with us providing resources and practical advice. Hope starts with us sharing our stories. Hope starts with us breaking the stigma. If you or a loved one is struggling with a mental health condition and have been looking for hope, we made this podcast for you. Hope starts with all of us. Hope is a collective. We hope that each episode with each conversation brings you into that collective to know you are not alone. Today I'm joined by NAMI's Chief Advocacy Officer, Hannah Wesolowski. Hannah came to NAMI in 2017 with more than a decade of experience in advocacy, joining the NAMI team after 5 years at the Public Affairs Council. She previously led political advocacy efforts at the American Speech Language Hearing Association and the American Institute of Architects. Hannah has a BA from New York University, where she also earned an MPA from NYU's Robert F. Wagner Graduate School of Public Service. And she has been instrumental in leading NAMI's efforts with more than 40 other partner organizations to reimagine our mental health crisis response system with 988. Hannah, thank you so much for joining us on today.
Thank you for having me, Dan. It's great to be here.
Yes. Hannah, how have you been involved in helping inform the development and transition to 988 from the beginning? For those who don't know, can you give us a little bit of background and context about how we got to this point of creating a 3-digit number for suicide, substance use, and mental health crisis that became available nationwide in July?
Dan, NAMI's been at the table really since this was just a concept, an idea. For many years, we worked to advocate to get information about what's the best number to use. Is this even possible? And then once that was determined, we engaged advocates across the country to push for this number to be available. That happened in 2020 with the number becoming available nationwide this year. And over the last 2 years, NAMI advocates across the country have been at the table to help shape a system that meets the needs of people with mental illness and people in crisis.
How's it been going? Thank you very much. How's it been going so far?
You know, this is a process. I keep telling people we are closer to the starting line than the finish line, and that's because we want to build a system that reimagines crisis response. 988 is a huge part of that, and 988 in and of itself is going to save lives because it creates this easy to remember number that anyone in crisis can call when they need it. And that is amazing. Who can remember a 10-digit number when they're in crisis or know which number to call? So making that easier to access is important, but we also know that some people need more help than can be provided over the phone. And that's really where NAMI's advocacy has been important, of creating this crisis continuum of care that provides support for people beyond a phone call if they need it. And you know, that effort is going to take long into the future, but I can say as of now, lots of people are calling 988. They're getting help because 988 calls are answered by trained crisis counselors who can help in any crisis situation. We're really excited to see the positive results happening across the country. And although we know we have more work to do to build up that capacity, it gives me a lot of hope for the future.
As we speak about hope here, let's peel this back a little bit and talk about what did crisis response look like before 988, and what is the hope for crisis response as 988 truly gets built out?
Yeah, NAMI members know better than anyone else the flaws in our current crisis response. In most communities, for decades, the only option that's been available is to dial 911. And what happens when you dial 911? They dispatch a response. And the response that they can dispatch is law enforcement. And so that leads to the criminalization of people with mental illness. And unfortunately has often led to trauma and tragedy. And we hear those stories every day from families who are desperate to get their loved ones help but don't know where to go. 988 is really an opportunity to change that paradigm. You call 988, you get connected to your crisis counselor. They can help anywhere from 90 to 98% of callers over the phone. They reduce the need for an in-person response altogether. But along with that, we're advocating for mobile crisis response teams made up of nurses, EMTs, social workers, peer support specialists that would be dispatched in the small number of situations that need it rather than law enforcement. So it's really about reducing law enforcement involvement and giving people help, not handcuffs.
Oh, that is wonderful. What are some of the things that we've been hearing so far in terms of this response rate? How's it going so far? It's just recently launched. And what does it look like right now in communities across the U.S.?
You know, that's the thing. This is different in every community. Overall, we know that just in the first week, call rates increased 45% over the previous week. So a lot of people are calling, but what's available is going to differ. The 988 Lifeline network is made up of about 200 call centers across the country. And what their capacity is to answer calls really differs. The good news is, even if your local call center is at capacity and can't answer the call, there are national backup centers. So no matter who you connect with, you're talking to a trained crisis counselor. So that's the important thing for people to know, that even if you're not connected locally, which is the ideal, you're still connected to a trained crisis counselor, which is really important in these situations.
This is just a great concept and now implementation of a solution. As you look at the build out, what do you see as the current state from the standpoint of funding? And what's needed from a workforce? So funding and workforce.
A lot. NAMI's been advocating with our Reimagine Crisis campaign. You mentioned 40 plus partners at the top of this, and we have partners that we've brought together from every aspect of the community. We have the major county sheriffs of America. We have the American College of Emergency Physicians, the American Academy of Pediatrics, and the League of United Latin American Citizens. Really a broad range of stakeholders that have a stake in getting the system right. And we've been heavily involved in pushing for more funding to go down to states to fund these call centers. Funding has increased tenfold for the Lifeline in just the last 2 years, but we need a lot more resources to be going locally. President Biden has proposed nearly $700 million for the 988 system, which is a huge jump from the $100 million we got this past year. So if that money comes through, that could be a complete game changer. We also know that a lot of states are advocating, and that's where NAMI advocates have been absolutely vital in pushing legislation and funding at the state level to make this a reality.
Have you found, I know that at the early days of the work that you were doing, and congratulations on the award in terms of the Reimagine Crisis Response campaign, just a wonderful acknowledgement of the great work you and your team have done and you did in creating this. So it's just a great campaign, and you're welcome. In terms of what we're seeing right now, where do we demystify what some people in the community are saying about 988? What are they saying, and how do we demystify that?
Yeah, that's a good question. So there's been a lot of rumors swirling around about what happens when you call 988, and it's really important for people to understand the facts here. The system we have now is you call 911 and law enforcement comes. That's the reality that we deal with. We're trying to move away from that, and that's where 988 is really positive. 988 calls are routed based on your area code, which is a work in progress. We're advocating with the Federal Communications Commission to move towards routing that is based more on your geographic area. But right now it's based on area code. So they don't even have your phone number and your exact location. So there's a lot of rumors that police are going to be dispatched if you call 988. That's the exact reality we're trying to avoid. Right. When you call 988, it is 100% confidential. You do not have to share any personal information. They don't have your location information. They cannot dispatch services. That does become complicating if they believe that somebody's life is in risk. And there's about less than 2% of cases where they have to involve emergency services. but they, again, don't have location information. So that's a very lengthy process to go through. And we know that in crisis situations, seconds matter, minutes matter. Yeah. We can't wait an hour to get that information. So that's something we're working through, but I think shows that that when people call 988, their location information is not available. No one can dispatch police, or we're seeing concerns of people being brought to the hospital. Again, we're trying to avoid that. We're trying to get people help and keep them in the community. And I think it's important for people to know that your information is not shared, and you don't have to provide any of that information. It's a confidential service.
This is incredible information that needs to be shared, and it kind of goes in line with something else that you and your team did early on, as you did an Ipsos survey. You had a survey done, and that survey gave some metrics in terms of what America was looking at in terms of what they knew and what they didn't know. Would you share with our audience what that survey really told us? Yeah,
some really interesting things. First, more than 3 in 4 people are not satisfied with the state of mental health services in this country. And that's not surprising. You mentioned workforce earlier, and people struggle with getting the help they need. The workforce shortage is immense in America. We have over 130 million people that live in mental health provider shortage areas. So when they feel like they need help, getting that help is nearly impossible, which means that we often don't react until someone reaches a crisis point. That's why our crisis system right now is so important, but our work can't stop there. We need to build out mental health services and get people help much sooner. Something else we found is that people overwhelmingly, not even knowing about this crisis system we're talking about, believe that when somebody's in a mental health crisis, they should receive services from mental health professionals, not law enforcement. More than 4 in 5 people said the response should be a mental health response. So there's broad support for this. Unfortunately, as of late May, early June, only 4% of people knew what 988 was. So we
only 4? Did you say 4%?
4%. Wow. 4%. So we have a lot of work to do to make people aware of this, and that's going to be the focus in the coming year of letting people know what you call for, when to call, how you'll get help, and really building up the capacity to meet the demand we anticipate.
So it sounds like capacity is critically important. Education is critically important. Education and awareness. What's going on right now? Because there was so much work leading up to the launch to inform, to engage. What's the work that's happening now?
So probably folks who are listening have noticed that there aren't these big public awareness campaigns that are happening around 988, and that's intentional. The federal government is waiting until next year to build up that capacity, but they're also sharing messages to relevant audiences and working with organizations like NAMI to get the information out there. It's a balancing act. We want people to get help. We also don't want to overwhelm a system before it's even off its feet. So NAMI is advocating for resources for that public awareness, as that's a big priority. Call centers are also trying to hire people. SAMHSA has a 988 jobs page that they are showing all of the openings across the country, and it's a lot. So recruiting that workforce is important, and training them up. They can't start answering calls on day one. They have to go through pretty extensive training to be able to respond to people, often on the worst day of their lives. So, that's an important aspect here too. We have the routing I mentioned, that's a big challenge. We also need to make sure this is a system that works for everyone. So specialized services for LGBTQ plus youth who are at extremely high risk of suicidal ideation. We want to make sure we're meeting the needs of communities of color who are often experience the worst of having law enforcement involved in crises, and also children. We want to make sure there's specialized services for children in general, and that this is a system that meets the needs at any age. So there's a lot of work to be done. That being said, just seeing the progress that we've had in the last 2 years and how many services have come online since 988 was passed by Congress is huge, and everyone needs to celebrate that progress.
Yeah, it's great news and a great future for this going forward. As we look at the body of work in terms of those 3 components, would you share with the audience a little bit more about someone to answer the call and just walk us through what are those 3 elements there, and I don't want to assume that everybody knows, because we still have part of our audience that doesn't know. So let's inform and educate them a little bit.
Yeah, and that's important because everyone needs to understand what's possible, and they need to push policymakers to fund it.
Yep.
So thank you for raising that.
Yep.
What we're pushing for is someone to call, someone to respond, and somewhere to go. Someone to call is those 24/7 local crisis call centers answering the 988 calls or texts or chats. We want to make sure that as much as possible those are answered locally, because when it's a local call center, they can connect people to other resources in the community. And that's important, right? Because we want to get people past the point of immediate crisis, and 988 can do that, but we also want to connect them to resources so they get well and stay well. We don't want people cycling in and out of crisis, which we see so often. For that small number that need more help, they can be provided over the phone or text or chat. Mobile crisis teams or someone to respond. And I mentioned that, healthcare professionals, behavioral health professionals who are trained in de-escalation, who can establish a rapport with an individual, identify what they might need, and many times they can resolve the crisis in the field. They don't have to take that individual anywhere. That's not necessarily the goal. But again, small number of people need somewhere to go.
Yes. And
crisis stabilization options are what we are advocating for. And this is the part that is the most rare right now across the country. We're looking, they might be a facility that's co-located with an emergency department. It might be a standalone facility. They're usually less than 24 hours, so it's not meant to keep people. It's really observation, de-escalation, figuring out what's going on with the individual, how can we best help. They might be able to start detox if substance use is part of it. They often provide peer respite services. And the vast majority of individuals can be discharged back into the community and stay stable long-term in the community because they're connected to follow-up care. That's what we want, because emergency departments often have long wait times, don't have psychiatric professionals, and we know our NAMI family, hear so many stories of people just struggling when they go to the emergency department and it escalating a crisis rather than helping.
Yeah, you mentioned, thank you very much. You mentioned our partners, and you mentioned the National Sheriff's Association and some of our other partners. How is law enforcement taking to 988? Have you heard anything from them in terms of, as we've started this, the actual launch and implementation?
Law enforcement has been incredibly supportive of this model. Talking to law enforcement is actually one of my earliest memories at NAMI, going to a Stepping Up event and hearing a sheriff from Colorado talking about, the only place I have to take somebody in a crisis is my jail. How is that right? How is that how we're treating people? That's not the job law enforcement signed up for. It's not the job they're trained to do, nor should we be asking them to respond to a healthcare crisis. So law enforcement has been a really important voice in this process, and they need to be at the table. They're always going to come in contact with people in crisis. We always need de-escalation training, but we also need to build partnerships so they're willing and able to hand off to a mental health crisis system. So having their voice at the table is important because they see all of the gaps in our system now, but they also need to be a partner in the solution.
Hannah, you're our Chief Advocacy Officer. In terms of what you and your organization do on behalf of NAMI and all of us, where do you see leadership, tone, and execution as being critical in this implementation across the United States? And not calling out any of the leaders, but how important is that both federally and then locally? And what can our members do and the audience do to help local leaders with their tone and execution?
Yeah, well, one thing I want to say, I'll talk about policymakers in a minute, but Dan, your leadership, because NAMI represents the voice of lived experience. And if we're creating systems that don't work for the people impacted, they're not going to be valuable. And you really encouraged us a few years back to run with this and really make 988 a priority. And because of that, we've been able to make sure that lived experience is at the table, that we're designing systems that work for people with mental illness and their family. So, in terms of leadership, I look to you and thank you for that, because this should all be centered around lived experience. In terms of policymakers, this is one of the few issues where there's strong bipartisan support. So when you look at Republicans, Democrats at the federal level, at the state level, we're seeing broad bipartisan buy-in, which is absolutely crucial. And that's why we've had such incredible investments in crisis services and mental health. I think the pandemic has certainly exacerbated a lot of needs and sped up the rate at which people want to invest because they saw so many of the gaps. But policymakers are stepping up to the plate and really making those investments. I think everyone agrees that we need to provide better crisis services for people who need it because so many people have seen that in their personal lives the last few years.
Yes.
Should we have needed to have waited till this point? Probably not, but at least we have that buy-in now, and that's really important.
We're here. As we look at the triage teams that we're hoping to build out, for those times when someone has to respond, how important is it to have peer counselors as a part of that team?
Oh, gosh.
What are the vital roles that you see, and where does a certified peer counselor or peer counselor serve in that?
I think peers are absolutely vital at every point in this crisis continuum. So in terms of answering calls, we hear a lot of stories, actually, people who called for help and they got the help they needed. And they said, I want to do this for other people. Having that experience and being able to connect with somebody at that level from your own personal experience, you can't match that because that is a level of empathy that you can't teach, that you can't duplicate. But for mobile crisis teams, when we dispatch those, peer support specialists are crucial because one of the things we see when law enforcement is sent, just seeing somebody in uniform often escalates the situation. It scares people.
It does, yeah.
And having somebody who you can say, I've been through this, like I understand what you're going through, this is what happened to me, is that what you're experiencing? Establishes a rapport and trust with the individual that's so important to get them the help they need, identify what they might need. And then, as I mentioned, there's a lot of peer respite options in these crisis stabilization facilities. And again, so important to have that level of support and buy-in. And, any of us, if we meet somebody who's in the same situation as us, it just gives us a level of comfort to know that somebody understands it, that we're not alone.
Yes.
And, peers play such a vital role in that, as well as helping to navigate the system and providing critical care. But I think just on that person-to-person level, it's absolutely vital.
Yeah, it's been a part of their journey, so they can speak to it in the first person, and they can really, help that individual, and even help the law enforcement person if they both respond together and just say, hey, let me address this. So it's very important for those that we talked about equity for just a second, but you have some communities that have had really poor outcomes when they've made the call. So they're suspect.
Yeah.
What can we do to put them at ease in terms of, from an equity lens, in terms of 988?
I mean, they've experienced trauma. It's legitimate fear. And I think that's why we all need to come together and support 988 as this crisis continuum of care, because we're trying to move away from what we've experienced historically. And again, if we can all push that shared vision of having somebody answering 988 calls, providing a mobile crisis response, providing crisis stabilization options, we're going to avoid a lot of that trauma and tragedy that people experience. So, trust is important. And I think, as more services come online and this crisis continuum is built out, people will see the positive results. But again, they need to know that calling 988 is confidential. Their information isn't shared.
It's confidential. Information is not shared.
Right.
Okay.
And there is a very specific imminent risk policy. So if a crisis counselor thinks somebody's life is at risk, which again is less than 2% of calls, there's a very specific protocol they have to go through. So they don't take that on lightly. And, it does take time to go through that process, and they will inform an individual that they are calling for additional help. And if that individual wants to provide their location, they can. So it is a very limited number of instances where that happens. And again, it is when somebody's life is at imminent risk.
Thank you. NAMI is so critically important to the implementation and the success of 988. And Hannah and her team, representing the National Alliance of Mental Illness, have just done a wonderful job of getting us to this point and taking us on this path that will lead all of our communities across the U.S. to a better outcome on responses to an individual and or a family member that's in a mental health crisis. So I want to thank Hannah, and as we bring this podcast to a close, I want to ask Hannah, is there anything she'd like to leave the audience with in regards to reimagining crisis response and 988?
So the beauty of 988 is it removes a lot of barriers to accessing crisis care.
Yeah.
You know, people don't have to remember a 10-digit number. They can dial just a simple number, 988, no matter where they live in the country. And that's especially important as we try to improve care for communities that have long been underserved by our mental health system.
Yeah.
Then we add to that the law enforcement involvement and the potential of this system to reduce law enforcement involvement, particularly for communities of color, is absolutely vital. And I know that that's something that you've been particularly passionate about. So would love to hear from you a little bit about your perspective on the importance of 988 coming online.
Well, I appreciate you turning the tables and asking me a question. So, it is critically important. And Hannah, up until July, the only number I could have called, 911, for one of my family members or someone who looked like me that was experiencing a mental health crisis may have ended in a bad outcome. Those are not just my personal feelings. That is a statement based on facts. We know that each year, people with mental illnesses are booked into our nation's jails and prisons 2 million times, where less than half receive treatment for their mental health condition. Between 2015 and 2020, 1 in 4 people shot and killed by police had a mental illness, with 1/3 of that group being people of color. And in general, the rate of fatal police shootings is significantly higher for black populations than other groups, with black people being about 3 times more likely to be killed by police than white people. Again, these are the facts, and yet our communities have long relied on police to respond to people in mental health crisis. That's right, we've relied on law enforcement to respond to a healthcare crisis. That's not the job of law enforcement, and it doesn't help people in a mental health crisis connect to the care that they need. And the facts and numbers represent real people with real mental health crisis. People like Daniel Prude, whose brother called 911 for help when Daniel entered an erratic state in New York. People like Walter Wallace Jr., whose family called for help when Walter was experiencing mental health crisis in Philadelphia. People like Patrick Warren Sr., whose family called for a mental health professional's help in Texas. All of these cases were given a law enforcement response rather than a mental health response. All of these cases resulted in fatal outcomes, many times in front of their own families. Knowing these stories and statistics, it's hard to imagine calling 911 for help if my son or daughter were experiencing a mental health crisis. The outcomes are too often tragic and traumatic for everyone involved, including law enforcement officers themselves, who are often the first to admit that they are not equipped to respond to psychiatric emergencies and situations that should be handled by a trained mental health professional. People in crisis deserve help, not handcuffs, and certainly not death. But ensuring people in crisis, especially people of color, receive the safe help they deserve requires us to reimagine our entire crisis response system. That's why 988 has been such an important initiative to me personally. It makes me feel like me and my community finally have a number to call. I am so encouraged to know that this number is now available nationwide. But I'm also very aware that it's only a first step, which I don't think many people realize. Hannah, would you speak about that in terms of it being that first step? What needs to be done? How can people get involved and help build on these efforts?
Thanks, Dan. One, I would urge people to go to reimaginecrisis.org. That's our campaign website. You can take action there. You can learn about the ideal crisis response. You can contact policymakers. There's lots of information there. So check that out. And talk to your policymakers. Talk to your family and friends. This is something that everyone needs to demand in their community. That's the only way we're going to get to a point where this is something that is available to everyone. So we all need to be part of that process, and everyone needs to contribute to that.
Thanks for sharing all of that information with us, Hannah. I think when people get the facts, it really is empowering. This is such an exciting and important time. I know there is still so much work to do, and so much of a challenge ahead. But I don't know about you, when I think about the work you and your team and NAMI and all of our partners and friends are doing in this space, it really does give me hope. Which brings me to our weekly segment, Hold On to Hope. The world can be a difficult place, and sometimes it can be hard to hold on to hope. That's why each week we dedicate the last couple of minutes of our podcast to a special section called Hold On to Hope. Hannah, can you tell us what helps you hold on to hope? And what advice do you have for our listeners?
I want to leave people with hope, that there is a brighter future ahead. I get asked a lot, are you optimistic, or, how are you feeling about this? I'm incredibly optimistic because I have seen the progress in just the last few years. And with this momentum, we have a real opportunity to fundamentally change part of our mental health system. And I believe that that's going to be a jumping off point for fixing a lot of other aspects of our mental health system. So I have a lot of hope. It takes time, it takes effort, but we have an incredible advocacy movement here, and I think we'll make it happen.
Hannah, thank you so much for joining me. This has been Hope Starts With Us, a podcast by NAMI, the National Alliance on Mental Illness. If you're looking for mental health resources, you are not alone. Visit nami.org/help to get in contact with the NAMI HelpLine and find local resources. Or, if you are experiencing an immediate suicide, substance use, or mental health crisis, please call or text 988 to speak with a trained support specialist. I'm Dan Gillison, NAMI's CEO. Be well.